From the opinion pages of the Wall Street Journal, this is Potomac Watch.
Welcome back. Alicia, before the break, you mentioned monkeypox. And do you think that some of the same problems that we saw with COVID-19 and public health authorities are being replayed now? And I would point to one thing. It's a op-ed from July in the New York Times by Scott Gottlieb, former commissioner of the Food and Drug Administration. And his answer is yes. And just to point to one thing, he says, it wasn't until late June that the Centers for Disease Control and Prevention expanded testing for monkeypox to large commercial labs like Quest Diagnostics and LabCorp for more capacity and access. And he's saying that it wasn't fast enough. The CDC is still slower than these viruses seem to be spreading.
I think that's right. And I would also put some of the blame here on the World Health Organization. Now it appears that the monkeypox actually started spreading in Nigeria in 2017, and that there were hundreds of cases. And sometime in 2018, the virus appeared to mutate and become more transmissible among humans. So monkeypox was first discovered in 1958 and was actually previously mostly transmitted between prairie dogs or monkeys, wild animals and humans. And there had actually been very limited human-to-human transmission. But now we're discovering, as researchers do often in retrospect, that this actually began circulating in 2017 and then started spreading probably 2018, 2019 beyond. And probably lockdowns and limitations on air travel actually limited how much it was spreading in the US and Europe. But then once those lockdowns lifted, travel bans lifted, started to spread more in Europe and the US. And a lot of doctors just weren't aware of it. They weren't looking at it because, it can seem like other herpes viruses, actually the manifestations may seem like other sexually transmitted diseases. And it was mostly spreading, as we have now discovered, among gay men who were having sex with other gay men. It was both the WHO and CDC that just weren't tracking this. Now, to the point of your testing, yes, the CDC was late to develop a test. And in fact, it was very limited who could get tested. They required that profound lesions be seen, whereas many individuals with monkeypox actually only have what appears to be ingrown hair or something like that. You don't have huge rashes, many of them. And so that really limited the ability for the CDC, public health officials at the state levels, whatnot, to really see the expanse of the monkeypox spread. And now there are about 14,000 cases that have been documented. There are probably many, many more, as officials say, because the testing still is limited and many people who get it don't recognize that they have it. Luckily, this isn't anywhere nearly as transmissible as COVID. It doesn't spread for the most part through the air. It's mainly skin-to-skin contact lesions. So maybe if you have close contact with someone in your household, actually one of the first cases to have been documented in Nigeria was an 11-year-old who apparently got it from an older sibling. But for the most part, it's really isolated to the gay community. I'm going to go off on an aside here. This is probably to some extent why it's getting so much flack from the left, because of obviously these are a politically important group, a socially important group that are part of the Democratic base. But if this monkeypox had actually been more transmissible and more fatal, again, luckily it isn't. We haven't seen any deaths, though it can be much more fatal to immunocompromised individuals, those with HIV. But luckily, we haven't seen any deaths in the U.S. If this were a more lethal and virulent disease, the Biden administration would be getting a lot more flack and would be for its slow response. And to me, actually, the monkeypox actually reveals that Biden, had he been president in 2020, when COVID emerged in the U.S., the Biden administration wouldn't have necessarily done any better than the Trump and probably would have made many of the similar mistakes as we're seeing with its slow vaccine response. May have been even worse.
Well, the story of these failures is why I have some sympathy, I guess, for Rochelle Walensky's idea that the CDC ought to be more of an action-oriented agency, though I'm sure she would not go as far as I'm about to suggest. If you look at the history of the CDC, it started in 1946 as the Communicable Disease Center. And I'll read just a few lines from its history page. Its primary mission was simple yet highly challenging: prevent malaria from spreading across the nation, Armed with a budget of only $10 million and fewer than 400 employees, the agency's early challenges included obtaining enough trucks, sprayers, and shovels necessary to wage war on mosquitoes, unquote. And so that explains why the CDC is in Atlanta, because it was set up to eliminate malaria from the American South. And Kim, as you say, now it has broadened itself. It's now the Centers for Disease Control and Prevention. It's doing research on gun violence. There was a long-running controversy in Congress because Congress had barred federal research on gun violence. That was recently lifted. And according to a Washington Post story, the CDC is now funding a couple of projects. There's one to evaluate Shoot Safe, a website aimed at teaching children how to safely engage with firearms. There's another bit of money being spent to evaluate the effectiveness of a bystander intervention in 50 4-H shooting sports club communities. And Kim, I mean, maybe there is an argument for really making it more action-oriented and turning it back into something like the Communicable Disease Center.
I like that idea. My only problem with it is that I have never successfully heard of an agency managing to reduce itself or fundamentally change its mission. I think what you'd ultimately have to do is blow up the CDC and replace it with something more along the lines of what you are advocating. And yes, that would be great. I mean, the political headwinds against that would be absolutely enormous. And maybe you get some future director that comes in and is completely divorced from or beyond any of the taint or the stench of COVID and the mismanagement, that has the ability to cast an objective eye on this agency and then has the fortitude to do some big and structural changes. I think we can all agree that that's not likely to happen under Walensky. But this is a problem we see across pretty much every agency in Washington. There have been some really great studies talking about programs in all of the different departments. Most of people are wandering into each other's territory. And this is what happens when you get big, unrestrained government bureaucracy. So I like your idea, Kyle. I think it is what probably needs to happen, especially because we should be concerned. You know, COVID was a deadly disease. We've heard a lot from some pretty important experts about the likelihood that as we go forward in an ever more globalized world, that we are going to have more of these pandemics and outbreaks. We need an organization that is absolutely top-notch, 21st century, ready to go to handle that, to learn from the mistakes. And I'm not quite sure that Walensky's argument that we need to take some action and care more about equity is putting us on the path to get to that kind of an action-oriented agency.
But last thought here for me, it does seem to me that the CDC's focus on this scientific research aspect of its job right now is in tension with the problem of what to do when you have a virus that is new, that arrives, you don't know a lot about it. And I think one of the things we saw public health authorities struggle with throughout COVID was, what do you do with uncertainty? And I think that explains part of why the CDC seems like it was late on all of these things, including, it was late in admitting that COVID seemed to be spreading by aerosols, which was a big deal. And it is hard for me to imagine the old malaria fighters with the trucks and the shovels trying to wait for the ground truth scientific paper to get through peer review before they take an action. They would be focused on, what are we going to do tomorrow to help stop the spread of malaria? And Alicia, we'll give you the last word.
Well, I think there was a lot of uncertainty. Yes, on the aerosol spread, they were slow to acknowledge the WHO, for that matter, was too. But so much of the problem with the CDC's, at least during COVID, was they treated it, at least initially, like it was a flu-like virus and could be contained the same way, and suggested or recommended restrictions, if you recall the infamous 6-foot rule that really, in hindsight, did absolutely nothing because it is spread through aerosols. The same is true for masks. And the problem is that the CDC has really been slow to adjust its guidance in response to scientific uncertainties or new understandings of how the virus behaves. And I think that's really been one of its core weaknesses during the pandemic. And in terms of taking action, I wouldn't necessarily support the CDC overriding the states. I mean, states and local officials really are the ones who have the quote-unquote police powers under the Constitution to protect public health and safety. The CDC's job is to help provide more resources, testing and such when it's helpful. But in the pandemic, on one hand, it's been more passive in providing guidance and recommendations. But many of those recommendations, as we've discussed, have been confusing, arbitrary, and have probably just added to the problems that we experienced rather than helped.
Thank you, Alicia and Kim. Thank you all for listening. You can email us at pwpodcast@wsj.com. If you like the show, please hit that subscribe button, and we'll be back next week with another edition of Potomac Watch.